Patient monitoring and telemetry systems. What is a patient monitoring system? Patient monitoring systems are made with high quality technology. They are used to check and record patients' health signs such as heart rate, blood pressure, and oxygen levels. This monitoring system quickly gives accurate information about a patient's condition. It makes it easy for doctors to check and make decisions according to the conditions. Patient monitoring systems. The long term objective of patient monitoring is generally to decrease mortality and morbidity by organizing and display information in a form meaningful for improved patient care, correlating multiple parameters for clear demonstration of clinical problems, processing the data to set alarms on the development of abnormal conditions, providing information based on automated data regarding therapy, and ensuring better care with fewer staff members. One of the patient monitoring system we can discuss here is cardiac monitor. A cardiac monitor is specifically useful for monitoring patients with cardiac problems, and the special areas in hospitals where they are generally used are known as cardiac care units or coronary care units, which is called CCU. These instruments are also called cardioscopes and comprises of disposable type pre-gelled electrodes to pick up the ECG signal, amplifier and a cathode ray tube for amplification and display the ECG, which enable direct observation of ECG waveform, a heart rate meter to indicate average heart rate with audible beep or flashing light or both with each beat, an alarm system to produce signal in the event of abnormalities occurring in the heart rate. These are the parameters which can be displayed on a cardiac monitor. One is electrocardiogram ECG signal, another one heart rate, pulse rate, blood pressure, body temperature and respiratory rate. In addition to these primary parameters, EEG, PO2 and respiratory volume also become a part of monitoring in special cases. This block diagram shows the important components of a cardiac monitor, which consist of heart rate and BP sensor, automatic reference selector, amplifier, sample and hold circuit, memory storage, analog to digital converter, microcontroller, temperature sensors, LCD alarm circuit and speaker. The cardiac monitor or cardioscope is basically similar to conventional oscilloscope used to display the waveform in electronic laboratories. It has a usual circuit blocks like vertical and horizontal amplifier, time base and EHT for the cathode ray tube. However, they differ in two important aspects as compared to the conventional instruments. These are slower speeds and a long persistence screen. Cardiac monitor consists of a slow speed necessitate the use of a long persistent screen so as to enable a convenient observation of the waveform. Without a long persistent screen, one can only see a moving dot of light instead of a continuous trace. Cardiac monitor. Most of the present day cardioscopes are designed to be used at the bedside. Some of them are even portable and can work on storage batteries. A large screen with about 50 cm screen size instruments are usually mounted in one corner of operating room at the height at which it is possible to conveniently observe the waveform being displayed. Small cardioscopes using 3 less than or equal to diameter cathode ray tubes are mounted on anesthesia trolleys. These are called anesthesia monitors. These monitors are used by the anesthetist for continuous monitoring of ECG of anesthetized patients. Low frequency waveforms, which are available from various physiological parameters, do not show up well in a conventional oscilloscope CRT screen because the scan is so low that most of the wave track is dark during the scan. This is particularly true in large screen displays. The display is thus continuous, bright and flicker free on a normal non-storage CRT. With the conventional oscilloscope, there is an unavoidable break in the chain of information between the end of sweep and the beginning of the next because of sweep circuit retrace and hold off requirements. Furthermore, this lost display usually extends while the oscilloscope waits for the next trigger. If the train of events being observed is sine wave, the loss of information during the hold-off period may be of no consequence. By using non-fading type roll mode display, waveforms can be paraded across the CRT screen in a continuous stream with no disturbances of any kind. The viewing window depends upon the sweep rate. Figure shows the same waveform train displayed by a conventional oscilloscope and by the memory monitor in the roll mode. Moreover, the ability to freeze the display in the roll mode at any point makes it easy to capture important data which can be outputted to a chart recorder. This block diagram shows the components in a cardiac monitor which incorporate digital storage in the oscilloscope displays. Any digital method of waveform recording will have an analog to digital converter which feeds data corresponding to the input signal into a digital store in a controlled write cycle. The data is retrieved through a small controlled read cycle and is reformed through digital to analog converter for display. Two important factors governing the final resolution are sample rate and word length. The writing sequence depends upon the constructions from 10-stage write address counter which is controlled by the time-based speed control. The write cycle control logic is designed to update or refresh the store whenever a trigger pulse is received, and hence the display follows changes in the input waveform as they occur. A separate read address counter continuously scans all addresses at a fixed rate and drives the wide deflection system of CRT through digital to analog converter. For monitoring purposes, the bandwidth is usually limited to 50 Hz. Therefore, a sampling rate of 150 or above will be satisfactory. Word length of cardiac monitor amplified in a preamplifier and brought to a level of 0 to 1 volt. The accuracy of conversion of analog signal depends on number of bits used in the conversion. Memory capacity, contents of each channel memory are displayed with each sweep across the CRT screen. Figure shows the block diagram of single channel cardioscope with digital memory. The ECG signal is sensed differentially by the RA and LA electrodes and is amplified by an isolation ECG amplifier. Patient circuit is isolated by using a transformer and by modulating 102 kHz carrier signal with amplified and filtered ECG. The modulated carrier is demodulated, amplified and applied to an analog to digital converter. The converter samples the waveform at a rate of 250 samples per second. Convert each sample to an 8-bit parallel word and enters the word into the recirculating memory where it replaces the oldest word stored. The three most common flat panel technologies in cardiac monitors are liquid crystal display, plasma display and electroluminescent display. Frequency response of cardioscopes. The monitor mode bandwidth is generally 0.4 to 50 Hz. In the diagnostic mode, the instrument offers expanded bandwidth capability of 0.05 to 100 Hz. Some instruments include 50 Hz notch filter to improve the common mode rejection ratio, and this factor should be kept in mind while checking the frequency response of the instrument. This figure shows the input circuit diagram of the present day cardiac monitors, there are three prominent circuit blocks: low pass filter to suppress RF interference, high voltage protection circuit, to provide voltage clamp in the presence of defibrillator pulses, over voltage protection circuit. This figure shows the quick recovery circuit in a cardiac monitor. In order to avoid problems due to DC circuit and supply voltage variation, ECG amplifiers are usually constructed with at least one stage of AC coupling. The circuit employs high value series capacitor in between two amplifying stages. A high value is used to maintain a good low frequency response. Cardiac monitors are also available which display more than one channel of information such as ECG and delayed ECG with the digital heart display and alarm facility. The display is for 4 seconds. The two channels can also be cascaded to have a 8-second display. Each channel in these instruments can be independently controlled for updating or freezing the information.